Not that bad, yet terrible. So you've heard some people say that COVID-19 is not that bad. You've heard others say it's terrible, and certainly public health experts across the world sure are acting like it's bad. Well, if you're confused, that's okay, because this pandemic is exactly not that bad, and yet terrible at the same time. Why is it not that bad? Well, compared to the first SARS outbreak, the current mortality of COVID-19 appears to be around 0.5%, which is not that bad. The first SARS virus had a mortality of 10%. Imagine 1 in 10 people that got infected died of that first SARS virus. Not that bad if you compare it against the 1918 pandemic. That had a mortality estimated at around 2.5%, or about 1 in 40 people infected. And that virus was really bad for people between the ages of 20 and 40, leaving millions of children without parents. I mean, that was horrible, really horrible. So compared to those outbreaks, COVID-19 is not that bad, right? Well, maybe, but it's still bad. Here's why. It's really infectious. It spreads pretty easily, especially when we're close and when we're inside. Lucky for us, the first SARS virus was not that infectious. It actually killed mostly healthcare workers in close contact with very sick people. If it was as infectious as this SARS virus, it would have made the 1918 pandemic look like a sunny day at the beach. So with a mortality of around 0.5%, and we don't actually know the exact number yet, and we won't until we get to the other side of this thing, and some people think it could be much higher than that. It's not that bad. Except it is. Let's just look at the US population of around 330 million people. 0.5% of 330 million people is 1.65 million people. That's the number of people that could die in the US alone if we just let this virus rip through the population, as some has suggested. That's a staggering number. Heart disease, the leading cause of death in the United States, kills just 650,000 people a year. But it mostly kills old people, you say. So it's not that bad, right? Well, even if you think the mass extinction of the greatest generation is no big deal, it doesn't just kill the elderly. Again, if we look at that 20 to 40 age group, it's true. The mortality in that group is only about 0.1 to 0.2%, right? Again, not that bad. Except that there are probably around 100 million Americans in that age group. So at the low end, left to itself, this virus could kill 100 to 200,000 young people. And here's the thing. All these people don't just die at home. They get sick. They go to the ER. If they're really sick, they get admitted. If they're really, really sick, they go to the ICU. The number of patients that would come to the hospital without mitigation measures like closures of bars and indoor dining and mask wearing and social distancing would overwhelm first the ER, then the ICU, then the staff, then the hospital, then the entire hospital system. Doctors and nurses get sick and cannot work. Those that are left are overwhelmed. All elective surgery stops, then all surgery. Then the trauma centers can't see patients anymore. There's no ICU beds. There's no one to look after them. Heart attack, sir? Sorry, we're overwhelmed. You're gonna have to sit in that chair with all the other patients. Try not to die. And we actually saw this. We saw this in Italy. We saw this in South America. We even saw it in parts of New York. And if your hospital system doesn't work, what does that do to your economy? Do you risk driving or going to work or leaving the house, knowing that an otherwise not so bad accident or broken leg or stick in the eye could be fatal? Do you go out knowing that the virus is raging? And there's no bed for you in the hospital if you get sick. So it is true, if you're young and healthy, your chance of dying or getting really sick is not that high. But does that give you much solace knowing that everything around you could collapse? And every now and then, one of your young and healthy friends will actually die. So yes, COVID is not that bad, but it's also terrible. And it's not just death. The more we learn about long COVID and the effect of this virus on even healthy people, the worse it gets. Maybe as many as 1 in 3 people will have a prolonged course, with fatigue and headaches and depression and blood clots and strokes. You really don't want to catch this thing. And now the vaccines are so close. If we slow the spread in the next few months, we can save the healthcare system and get vaccines to millions of people. Vaccines that are truly remarkably effective at reducing the mortality of this disease. Reducing it by a kind of staggering amount. And as Dr. Fauci said, you don't want to be the last soldier killed right before they call a truce. The war will be over soon. The vaccine cavalry is coming. Now is not the time to be callous and get shot, or worse still, get someone else shot. So wash your hands, wear the mask, don't gather in groups. COVID-19 is not that bad, but it's terrible at the same time. But little things that you and I can do can have tremendous benefits that will help everyone. So let's do these last few months together. And when I say together, I mean 6 feet apart.